Good morning, guys. How are you all doing this morning?
Well, good, thanks, Mark.
Great stuff. Thanks a million for joining me today. And we're going to have a good old chat about TRIOS. So so what I'd like to do is maybe just have a bit of a chat about your stories. You've all got TRIOS now in your practice. You've had it for varying amount of time, and you've been aware of it for quite some time. So I want to start off with that. I often reflect if on our first encounter, which is probably 2013, 2014. It was my first road trip with TRIOS, and it was the original cart unit. It was a heating element that you had to put the scanner onto. It was a bit like a Dalek that was contained in a fridge. So I remember coming to see you at that time, and it was an interesting day. And last year, then of course you finally got on board with TRIOS. So tell me, what was your kind of motivating factor? Why was the time right last year for you to get on board with TRIOS?
Well, I think, obviously, we're all doing a lot of ortho now. We've been doing that for many years, but it's become such an integral part of all of our daily treatments. But I think what really kind of triggered it for me was probably watching the speed of the latest TRIOS models, and also the fact that they had the patient monitoring. So that really triggered it for me, because a lot of what we're teaching and what Daz, myself, and Andy, we're teaching IAS is it's very much about actually looking after patients, seeing how their teeth change over time. We all were using intraoral cameras and showing patients, but this was something that really was so impactful to be able to, even over a short period, it could probably a month you might be able to see a difference, was to be able to see little individual changes in teeth, to be able to monitor and to diagnose better. So for me, actually, I think the way the whole software worked, how quick it was, and also the fact that monitoring was there, was really our trigger point.
Yeah. Okay. Great stuff. Thanks. And how about you, Andy?
Well, I've been using digital scanners for over 10 years, and my main reason for getting into it was chairside milling. But the whole thing's so much further on from that now. And again, patient monitoring was one of the reasons that I got on board with TRIOS when I did, because you and I have had conversations for years over this, and I just wasn't ready to go. I didn't see how it could add to what I was doing. But now, as Tiff said, the speed of it is unreal, and it's genuinely part of sort of the routine dentistry. It's part of my everyday checkup, really, because of the patient monitoring is the reason that I got it. But it's part of everything now. It's part of patient communication as much as sort of any other part of the checkup.
Okay, excellent. And as for you, I remember, was it 2017, I think, when TreeShape launched the wireless TRIOS, and at IDS in March, back in those days when we could all gather in huge halls and not have any fears. And I remember just shortly after you gave me a call and said, Mark, let's do this. So tell me, why was that? Why was it right for you at that point?
I mean, our conversation started before that as well, Mark. And I remember, in our surgery, what we found is that, much like Andy, that we had a scanner that was designed for in-office milling, and my partner, she does a lot more endo treatment, so hence she ends up doing a lot more single unit crowns uses. So every time I wanted to go and use the scanner, it was just like a faff trying to move the thing. So I made a decision that I needed to have one with me all the time, and it was just basically that I have a small area and where my surgery sits, and I need something that I could just easily pick up, scan, and then put away. I didn't want it to move around. I just wanted it to kind of be sort of, to me, it's almost as integral as a handpiece in our clinic. It is certainly in my surgery. So I remember I was in IDS with Anup, and we were having a little look, and then suddenly they launched this wireless, and I was just like, this is it. This is what we need. This is what I certainly need, because I didn't have to worry about faff around wires, didn't worry about things getting caught. It was simple and straightforward. I think I messaged you as soon as I saw it when I was there, to be honest, Mark. And it was just get it done, because I remember when you came over to the clinic, and I mean, you could see the potential of what it was, and I could see how I could change what I wanted to do in terms of practicing, and what that would mean to it. It was just, as I say, it was just when I finally went wireless, I was like, this is the time to push the button and just go with it, and not really look back since, to be fair.
Yeah, Brilliant stuff. And I suppose one thing people often talk about when or ask us when we're having that conversation about wired versus wireless, and people have maybe been scarred previously with wireless products and just feel that it just doesn't work. And obviously there's pros and cons to both. You've got wireless technologies, even wired technologies. Cables can fray and cables can get damaged and cables can snag and so on. So there can be issues with that too. Any message there for people who are maybe a bit concerned about a wireless option?
Yeah, I mean, so we have 3 different types of scanners in our clinic. And, you know, we've had one particular scanner where we've had to replace the lead at least 3 times for it, okay. Because you're going to scan for a patient and then suddenly it's just not working, or it's slow, or it's not picking up the detail. I mean, initially, I have to be honest, I was kind of worried about it, and people were kind of putting me off a little bit about the fact that you shouldn't really buy wireless. But I mean, I've had it for 3 years now, I think it is. And, you know, I use it for all my liner treatments. I use it for restorative. I use it for implant work. And it's been phenomenal, to be honest.
Yeah.
You know, I think maybe you might be able to scan a little bit quicker with wired, but it's not, the differential isn't like, you know, minutes or anything like that. It might be just seconds here and there. But, you know, for what I do, it's great.
And for me now, you know, I'm demoing with wired versus wireless. It takes a very fine-tuned eye to observe any difference, you know. So from performance-wise, it's not an issue. That's really good to hear, and thanks for sharing that with us. And so we've kind of touched on kind of how you're using it, and I guess people look at an intraoral scanner as being a digital impression system, and that's kind of where the line where the story ends. But obviously it's not from what you're saying there. So can you maybe elaborate, starting with yourself there, Andy, elaborate on how you're using the scanner on a daily basis?
It is part of for almost all my patients, it's part of a checkup. Okay. I have digital radiographs, the scanner type, the film, and I can take a digital scan in the time that it takes my nurse to develop the digital x-rays. So it is minutes. You know, when I was using the other one more routinely, it was the FAF. You know, it's like a Dalek, which you had to wheel in, set everything up. You had to set an appointment to make a scan. You know, you had to set 15 minutes aside to make a scan. This is 2 minutes and it's done. It is part of my checkup. It's a really important part of communication, because even more so than when you put a photograph on the screen in front of a patient, when you can show them how their teeth meet, when you can show them, you know, essentially you can go down to the margins, the fillings that you can see on it. And it opens patients' eyes to what's going on, and it creates a conversation, because patients will then start asking about the color of their teeth, because the color rendering is that good. Patients will start asking about the black fillings, about the rotated teeth, and you know, it's part of a record, but it's also a way of having a conversation with patients. And I when I don't have it, I really miss it. You know, if I've set it aside to do something. So it's part of everyday dentistry now. For as Daz said earlier, it's as important as a turbine right now. more important maybe.
Brilliant stuff. And how about yourself, Tiff? Obviously there's a few associates in the practice there as well. I'd say, is there much kind of fighting for getting access to the scanner?
Yeah, it gets physical sometimes, but no, we time things pretty well. And I think the other thing is because it's so fast. It's, you know, you get the scan done really quickly, and you know you can buzz it around, you know, surgery to surgery without any issues whatsoever. But I would say, you know, adding to what Andy was saying, I think a lot of courses, you know, we're talking about to the delegates, we're sort of talking to them about talking to their patients, and it's an amazing number of people that don't have scanners, never had an intraoral camera, don't even have an SLR, and I always say to people, you know, what would you say has always been the biggest problem in dentistry, you know, politically and with regards to patients and how they think about a dentist? And everyone said the same thing. It's lack of trust, isn't it? You know, it's been there since I trained. I remember from day one. And actually, I found back in 1997, the solution to that was to, at that point, use an intraoral camera. And yet, so few people are using any form of technology like this. And a scanner, you know, it's not just taking amazing impressions, it's actually, you know, solving that problem literally in an instant for you. So yeah, I think for anyone who's kind of got, if you've ever had a patient ever doubt anything that you've, you know, suggested or recommended, you can solve those problems virtually instantaneously by actually showing the patients in detail what is going on. And I just think it's astounding that in dental school and in dental, you know, training, that message is not more forcefully put across. That, you know, we dentists go through the whole career. Sometimes, you know, some of these guys get depressed about the fact that how the relations are with patients, and yet you can actually immediately get trust by just showing them something visually. And scanning now obviously is at the top end of the ability to do that. So for us, for me, it's always been about, you know, pre-scanners. I still have an intraoral camera, but fundamentally now the scanner is the best developed kind of technology to show people where they are and how things are changing. So that's for us what it's all about, really.
Yeah. Okay. Just interestingly, we haven't really talked about actually taking an impression for a restorative case or for an implant case, which so many people would look at. That's the primary purpose of the scanner, and we're just identifying that it's probably a minor purpose of the scanner. Obviously, the way you guys are using it, and for yourself, Daz, in terms of implementation, how you're using it.
Yeah, I think, you know, a lot of to be honest, one of the big reasons why I was looking at getting a scanner in, it was because I could see that there was a shift towards moving things digitally. So you could see that, you know, we weren't just talking about taking a scan, doing a prep, taking a scan, and then milling a crown. It was much more about, once you have a digital scan, what can you actually be able to then do with it as well? So I was much more intrigued along that line. I think that, you know, yes, being able to take scans for restorative work and trying to do it for implant work alongside for aligner therapy was good, but I was also much more intrigued about the planning side of it in terms of what we could look at trying to really use, what we could look at trying to use this for. And, you know, it's important that I had the right people and the right mindset to be able to do that. But I felt that it was really sort of, you know, for us in terms of for me, particularly in the practice, I felt that it would really help me in terms of being able to look at trying to elevate how we do things and just look at trying to make certain systems a little bit simpler and a little bit easier to try and work around. You know, and it's kind of worked out quite well for us, to be fair, in terms of how that kind of gets along, to be fair. But what's really interesting is I think all three of us have different styles of practices a little bit. So all three of us generally tend to use it slightly differently. But what's been really intriguing is how important it's become to all three of us in terms of how we use it almost on a daily basis as well in our practices.
Yeah. Okay, great stuff. And tell me about while we're on that, your learning curve. I think I think you all had kind of from my perspective anyway, it's a very similar learning curve, i.e. we shipped the scanner over. We shipped the scanner to you, arranged training, and when we got there, you know, we were, I particularly was kind of blown away by the fact that you gotten yourselves up and running with very minimal kind of input from us, you know, which is great to see. Scanning, it can be complex. Scanning can be technique sensitive, but at the same time, you guys kind of got off the ground kind of running. So Daz, for yourself, obviously you haven't had experience with other scanners previously, but what was the learning curve like for you from when you unboxed TRIOS and to kind of get into?
Yeah, I remember it landed literally, I think it was the night before I was about to head off to a BACD conference.
Right.
And
I remember that, yeah.
I was just dying to get into it and just get it all set up and get going. And I had to wait 4 more days to do so. But yeah, the way I describe it is very much point and shoot. So you kind of, you know, if you've had use of using scanners before in any way, shape or form, once you're used to it, it was very much in terms of, you can just kind of go in and sort of just take the scan as you wanted to. And the thing is with the wireless version is that I don't have to worry about a cable wrapping around and sort of strangling a patient's head or anything. It was very much that I could just lean the patient back, just take a scan. And you could almost do it double-handed if you needed to be fair as well. So it's, it was very sort of simple, straightforward. I remember when you came in and you said you only have to watch 1 or 2 sort of videos about sort of I've forgotten what it's called, is scanning techniques or strategies. That's it, scanning strategies. And once you get an understanding of sort of how it's sort of way for you to take the scan, and once you work it out, then it literally, I mean, it doesn't take very long to try and work out how that gets done. And you know, if my clinical staff team can work out how to do it, it's fairly straightforward to do, to be honest.
I think it's really important, just for the purpose of clarity here, we don't want any negative feedbacks there, comments on social media there, but there are no reports of patients being strangled by a TRIOS wire. I can't speak of any other scanners that are out there, but I know for TRIOS anyway, I'm not aware.
Mine's wired, and so far, no dead patients. So.
Good stuff. And how about yourself, Tiff? How about the learning curve? Again, I came over and did training with you. In the run up to Christmas last year, I think, wasn't it? But at that point, you'd right.
That's right. Well, we had the scanner a little bit first before you came down, only very briefly. But actually, before you came, I think we were just kind of playing with it, and it was quite intuitive. It's quite intuitive. You can kind of work your way around. I think and we thought, well, we're sort of managing to actually capture scans and figure our way out. But actually, in truth, when you came over, it was like completely eye-opening, and we thought, wow, we didn't realize it did that. Wow, we didn't realize it did that. And that was really, really worth the time. I mean, it was just so useful. And basically, since that day, since you came over, it completely changed our workflow, and it just made everything much more efficient. So everyone really knows what they're doing with all the dentists using it, all know what we're doing with it. So it makes a huge difference having that bit of extra time with you hands on, for sure.
Yeah, great stuff. And I think it goes to show that it's easy to use. I often talk about a love-hate relationship with the scanner, and that you can love it, and sometimes you'll hate it because you can't understand why it's not reacting, why the software isn't clicking, why it's not capturing information. But it's like that, and when you have that time, when you put that time aside, and obviously we're doing a lot of that remotely now and creating some online content, just to help people understand what's going on there. And it just means that we move away from the hate side of things and move towards more and more towards the love side of things. And for yourself then, Andy, how about your learning curve?
Well, I'm going to go back a little further. Say I had a scanner for chairside milling for like 10 years. And when I first got into that, you had to be really invested personally in learning how to use it, because it was not easy, and you had to adapt how you did things for it to work with the scanner. It's so much the opposite now. It is so easy to use it. You and I had it all plugged together. You and I had a quick half-hour FaceTime. Who does FaceTime anymore? We had a FaceTime in the evening to get me up and running, and then I watched a couple of the little videos and scanning strategies, and we were doing pretty well. Because it was a couple of weeks before you could come up to us. And that first day that you spent with us helped us work out where we were going wrong. Helped us understand the scanning. So as you said, took us away from the bits that we weren't getting on with. But it's now these scanners, a little bit of training online or in person. And you can work out how to use them very, very quickly, and you can get great results. And it is something you can genuinely get your team to do. You came up and you trained some of our team. Genuinely, it's so fast to use that I rarely actually let them do it. It's normally me, just because it is so quick. It's just the way the workflow works. Again, if you had to set aside time to do it, well, then the team members would do it. But it's just so fast to do. So it is genuinely very, very straightforward, and it's the user interface is very understandable, and it flows very well. As I say, I have it in my own practice, but I work in a referral practice as well, so the scanner goes with me. So that's why I chose the laptop version. It all goes in a box on a Friday into the back of the car, and into the other practice on a Monday. And I say I hate to be without it. Yeah,
very good, brilliant. And from a practicality point of view, there's some obviously scanning is scanning, and there's some bits of maintenance and kind of housekeeping, I suppose, in terms of routine calibrations. Which, as you know, my background is engineering and precision measurement. machine maintenance and so on. So when somebody says you need to calibrate this measuring instrument on a regular basis, like, well, that's a no-brainer in order to maintain accuracy. In the same way we check our clocks in our houses, and back in the day when it was all wind-up watches, and the car clock and so on, you check that against some standard, and whether that's Sky News or the talking clock or the church bells or whatever it might be, we'll always work off some kind of standard. So is calibration, that's a weekly thing that fits into your normal routine in the practice? Would it be fair to say that? Yeah, it's not a
it's pretty straightforward. I say mine goes into a box on a Friday to go to the other practice. So Monday morning when I take it out and turn it on, it's 2 minutes. It asks you to do it. You click the little thing on, and it's not in any way time consuming.
Yeah, great stuff. And what you're doing there as well, it's really important to bear in mind, is you're number one, you're ensuring the accuracy of the scanner. You're ensuring that you're going to have a maximal performance of the scanner. And also number three as well, which is something you've spotted kind of coming in the past 6 months or so, is the scanner diagnostics capability. And that's like kind of taking your car for a service. Guys, plug your car into a computer, run some diagnostics, and identify, well, actually, you know what, there's something here, it's fine, it's working, it's within thresholds, but actually, it's just maybe creeping up a little bit too high. We might need to take some remedial action. And we've seen some situations where that has worked as intended, i.e. there's maybe a little something kicking in with the scanner before it's actually noticeable by the customer. So we get 3Shape involved, and they dial in, adjust some settings and so on. So it's a really useful tool. So definitely it's good to hear that it's not a burden on your workflow on a weekly basis. And then tell me about the tips. Obviously, we've got an autoclavable tip, and a lot of technologies out there have autoclavable tips, and some have single-use sleeves. And it kind of ties into then, I suppose, the number of patients that you'd see. So, and then I suppose that kind of adds into ROI stuff as well, which we'll maybe talk about in a moment. But any issues with autoclaving tips? Tiff, maybe start with yourself. Sorry, go on, Andy. You started there.
Andy, go for it.
I use it so much that I, at the start, bought an extra set of tips. And so far, we've had none of the tips that have needed to be replaced, other than having to buy some extra ones. Being honest, one of the reasons that I did actually go probably towards the TRIOS was the fact they have reusable tips. What I didn't want to do was lift the scanner and think, well, this is going to cost me X amount just to take a scanner as part of a record or anything like that. So I didn't want that mental barrier that it was going to cost me money to take a scan. So that was one of the selling points for me for the TRIOS, in that I knew what the cost was going to be up front, no matter how many scans I was essentially going to be taking or what I was taking them for. I didn't need a return on investment on that scan. It was just going to be part of the record, or was to have a conversation.
Sure. Okay, thanks for that. And yourself, Tiff?
Yeah, same thing. I mean, I think actually, the reusable tips make a massive difference. And I personally wasn't that aware about some of the other systems out there, using single use. And I went with TRIOS because I just wanted the TRIOS, and I was impressed with what I saw. But I have to say, if I'd realised there were a lot of others with reusable with non-reusable tips or single use, that would have counted it out for me almost from the off. And the whole process of putting them through, sterilising, and then when they come out and you're looking at them, they're literally they're still looking great condition, ready to go. You're confident that they're nice, everything's nice and clean. And it just becomes basically a normal part of the whole sterilisation procedure with all the other instruments and bits and pieces going on. So don't even think about it. Okay. So I think that's a really good design, actually. Yeah.
I'll be honest. I mean, I think I kind of underscored how important it would be. I mean, we invested in another scanner predominantly for the team, and again, it's one that predominantly uses reusable tips. On two sides. One is I completely underscored how much the team would use something like that. So when the bill for the reusable tips came in, I was a bit shocked, to be honest. And then I was doubly shocked when I found out that the prices of them went up again after about 6 months after we got it in. So it was just like, the idea of just having, tips is not something I never thought I would be worried about when I buy a scanner. It's not something I ever considered as like an issue. But then, yeah, suddenly when you start when you start looking to other systems, you can suddenly see the value of having tips that you can just reuse, to be honest, because it's not, as Andy says, you know, you don't want to be thinking about, you know, if I take the scan now, it's going to cost me X amount of money. And then, so is there a point in doing it? You just want to pick up the scanner, take the scan, and then not have to really worry about any sort of other additional financial impact on that sort of thing, to be honest.
Sure.
You just want to be, you actually want to use it for the reason why you got it, which is basically, you know, either you're scanning a patient on a daily basis for the exam, or you want to show them something, or for any kind of variety of different uses, but then not having to worry about whether it's going to cost you another few pounds to do so or not.
Sure, for sure. And would you be able to approximate how many scans you do a year or per day? How often do you use the scanner?
I mean, for myself, I probably do somewhere between 10 to 15 scans a day. Yeah, certainly in the clinic.
Yeah, so it's maybe 200 a month, 40, 50, 60 a week, 200 a month. So that's 2,000 a year, perhaps. That's if we were in a single use environment there, that's 2,000 tips that you'd have to pay for, that you'd have to stock, and you'd have to dispose of. And of course, it's cost of disposal, but also just even it's a chunk of plastic that's going into landfill or being incinerated. So there's obviously an environmental impact there as well. So no, it's good to hear. Good to hear that it's working out. And I think the other thing as well, Daz, you know, you don't order bucket loads of tips from us, so you're obviously getting a good usage out of your TRIOS tips, that they're withstanding the autoclave procedure and and lasting the journey there, going the distance.
Yeah, I mean, from our side, I think that, you know, we really not stretch them out, but we just try to, you know, I also appreciate the fact that you need to care for these kind of things. Ultimately, it's what drives the final scan. So, you know, we need to, you know, everyone, should we say, in the practice is drilled to look after them, so to speak. And, you know, we maybe had wanted, I think initially everyone was looking after them a bit too well, where the little plastic cover you have on the top of the TRIOS, that got autoclaved as well by accident. So
that's number one support. We got two support calls. One is, I've autoclaved my protective tip. That's always within the first week or so, and the other one is, what's the password? But apart from that, everybody can do everything wonderfully well. But yeah, that's an interesting one. All right. Moving on to some of the ROI. Again, you know, people ask us, well, how am I going to make money out of this, or how is the scanner going to save money? And again, we haven't even really touched on it's a replacement for conventional impressions. You know, so look, where from a cost effectiveness point of view, kind of where does how does TRIOS work for you in your practice? Daz, is there a hard ROI? Does it save you X amount of money per month, or does it generate more business, or how does it work for you?
I've had this conversation a lot with people, and I think predominantly, if you're looking for an ROI out of a scanner, I predominantly think that you're looking at it in the wrong way. I think that, you know, when you're looking at impressions, you're looking at very much of a horse and cart way of trying to do things. But when you get given a scanner, it's suddenly you've been given a car. Now, it doesn't mean that because you've been given a car, doesn't mean that you just do the things you did with the horse and cart. I just think it just opens up a wide load of possibilities of things to do. As an example, you know, I know that over the last few years, TRIOS have developed these excitement apps, which have been fantastic. So I look at something like the Smile Design feature that's on there. That has nothing really to do with the scanner, so to speak, but the ability to be able to put a few photos in, just to do Smile Design on it, and then I can help someone who maybe needs multiple implant treatment see what things could look like. Has had a massive impact in our clinic. So, you know, alongside of that, and then be able to take maybe some 3D scans, so I can then digitally talk about a case with either my implant surgeon or with my ceramist, and say, look, where do we think we want to try and go from here? Do we want to use some aligners to move teeth? Are we going to be doing some multiple unit treatments? Are we going to be using implants in these kind of cases? It just heightens the kind of treatment planning and conversations I can do, that I can then use with the clinicians around me. And, you know, I think that people are looking at it as purely a financial exchange from using pressure material to this, I think it's maybe looking at it in the wrong way. I think that predominantly you're given this massive tool that you've got so much potential for. I'll be honest with you, Mark, I don't think I'm still using it to its full capability yet. I know we're using a lot, we use it for a lot of different things, but there's a lot more that I want to be able to get done with it. And so in terms of ROI, what it's really helped us do is really helped increase uptake in patients on, say, on some case plans, whether it comes down to implant treatments or whether it comes to aligner therapy. But yeah, as you know, I don't look at it as like I bought a scanner and now my impression bill has gone down. But it's helped me get so much more case acceptance for a lot more, shall we say, bigger plans and things like that as well.
Yeah. And how do you feel about that, Tiff, yourself?
Yeah, absolutely. I mean, again, I mean, it isn't just about, I mean, I've got no doubt the impression bill has come down, but it's not been that. That's been not really in the forefront of my mind, anywhere in my mind, if I'm honest. What it's really about is being fundamentally about communication, about a lot of the things that we're trying to talk to and explain to our patients about every day, why their teeth are moving, how their teeth are moving, what direction their teeth are likely to moving, how the wear is going to be changing, why this upper tooth is drifting forward because the lower's come forward and it's knocking it. Now we've up to pre-scanner, it would be, you show someone a photo, you try and explain it, and some people got it, other people didn't get it. But actually, as soon as you can show somebody in 3D, you can spin their teeth right round, you can see it on the inside, you can see that interfering contact, you can actually highlight the contact. The patients start to understand that they may see the images over a period of time, so you can actually see them physically moving. But even if they can't, and it's a single static scan, it's very easy to explain, a constricting envelope or a premature contact or something like that using a scan. And patients, when they see that, they're far more likely to at least register it in their mind. And the way we've always tend to work in our practice, we tell patients everything. We don't try and sell them anything, we tell them everything. And if you tell people things and you show them, they'll make their own decision. And normally these people will be back, it could be 6 months, it could be 2 years or a year, and those patients are saying, that thing we were talking about, I can feel it, let's go ahead and get it fixed. And the scanner is a really good way of patients visualizing it. So yeah, I think it just as I said before, with what I said with removing of doubt, it's not even removing of doubt, it's actually helping people to truly see what is going on in their mouths. Whereas up to now, all we're doing is just describing to patients what's going on in their mouth, and we expect them to kind of take our word for it. When you can show them it in in absolutely clear crystal 3D, these people will actually want the treatment and they can see the benefits for it themselves. So yeah, for me, it's an absolute no-brainer. I mean, at the end of it, I would say, if anyone that hasn't got that sort of technology is massively missing a trick. So it's really, really important part of our daily treatment workflow.
Sure, brilliant. And have you anything to add to that, Andy?
Again, it's not about the reduction in impression. The most expensive thing in the surgery is the clinician's time, and the fact that you can do things far more efficiently. You can take a set of records far more efficiently. You can utilize them there and then, rather than having to wait for them to come a week for them to come back to the laboratory. So you can start planning the case. You can take all the records there and then. You can take them home with you on the laptop and do your treatment plans from home. As Tiff says, you're having better, more informed patients. They have a much better idea of what's going on in their own mouths, so they're better educated and informed, and they're better able to make a decision about what's going on, rather than us just assuming they understand from what we tell them, which we know everybody communicates and understands things in different ways.
Of course, yeah. So
it's opening doors, it's creating conversations, it's increasing uptake, it's reducing chair time and reducing planning time. I'm not very good at sitting down and working out figures, and I didn't buy it for a return on investment, essentially, but it's making everything more efficient.
Yeah. I would just add, actually, I think as for dentistry itself, if we are looking to move the profession on, we need to get away from using things like dental charts. What is a dental chart? It's this standardized recording medium that we use. And what I always say to people is, you do a dental chart, if the tooth is slightly chipped, marginally moved, marginally worn over only 6 months, do you really think you're going to be able to tell the difference with your eyes and a dental chart? No. You know, dental charts to me are one of the most useless things we've ever had. And it's something from back from the 50s. You know, a dental chart now should be a 3D scan. It's as simple as that. That's what it should be, because you can look at every single tooth in total 3 dimensions, and you can then look at it again in 6 months and say, has it actually changed? Has the gum worn? Is there any tooth surface loss? Has that amalgam chipped? Has a tooth actually moved? So I think that, you know, why would we even use the dental charts as they are currently? You know, I find that it's astounding that that's what we're still stuck with, when, as I say, cameras have been there for a while, and now we've got scanners and we can absolutely track everything. And as we say, it just then becomes, there's so much potential conversation with patients. You know, my checkups end up being virtually talking about every single tooth and what's going on with every tooth. You know, we don't talk about the weather or Brexit or COVID or anything like that. We literally spend the whole time talking about their teeth. We're done, they leave. that's it. Unpleasant to my patients, of course, but we're not having to fill the gaps in, because these, you know, this sort of software, this imagery gives us so much to actually talk about, and the patients know that you're hugely invested in what's going on with them, and they know that you care about them. You know, you're not just looking to say you're fine, goodbye. You're actually like, this is going on, that's going on, and that's really, to me, what a dentist should be doing.
Yeah, absolutely. I went to get my eyes tested a couple of days ago, and it's great. I suppose it's like dentistry to some degree, is every time you go, there's a change, the technology has improved or whatever it might be. And you know, thinking with my kind of normal interactions with dentists and so on, and they can see the computers there's the side, and they can see there's a chart, and it's got numbers and bits and pieces, and the optician pulled up some scans of my eyeballs from this visit and from my previous visit as well, and you can pull them up and say, look, everything's great. He baffled me with some numbers and so on, and yes, you're looking at, well, these are the thresholds and you're within it and you're fine, that's grand. But it's like when it's visual and it's an image there in front of you, and you can see there's my eyeballs, how they are now and how they were 2 years ago. In fact, it was actually 4 years ago. I'm as bad as going to the optician as I am going to the dentist. But yeah, it was a nice reassurance for me. And like that, if there was something to be alarmed about, well, you know, it's I was going to say black and white, but it's in full color on screen there for me. So that's brilliant. So we talked a lot about communicating with patients and the patients kind of embracing what's going on and so on. One thing that dentists often talk about is, and particularly when we do that first scan and they're now seeing a prep 50 times bigger than what they're normally seeing as and realize, my God, is that really what I produce? And do labs really see that when they scan in a model or an impression? So you know, there's a kind of there's a feeling there, and genuinely dentists will say that actually they tend to be a little bit more critical of the work, of their own work when it comes to restorative work. But they also agree that the communication with labs is a lot better. Would you feel that you communicate better with, or your labs maybe can communicate better with you now as a result of sending through digital images? Andy, can I start with you?
It is actually great to be able to look at your own scans. You know, taking on from that point, you know, you have the ability to modify a prep once you've taken it. You take the scan of the prep, you look at the analysis of it, you see that you haven't recorded the margin or you haven't taken enough off the occlusal surface. You can go back in, delete it, take it again in a second. You know, instead, you know, if you're doing multiple preps, to have to repack all the cord, to retake the entire impression, that messes up your entire day. Whereas if you're doing that with a scanner, it's a matter of 2 minutes. And then once you've taken your scan and you're ready to go, you can annotate the scans of the photos of the scans to tell the laboratory what you want done in each part, where you want them to take the shade. And again, with the TRIOS, the shade is recorded in there for you. It's the workflow is just so much smoother and the communication is so much easier. I will do a lot of, well, not a lot, the odd sort of rehab case, and to be able to get those back from the laboratory relatively quickly with your digital wax up on there. And it's so easy then to communicate with the laboratory and tell them what you want changed, what you like about it, what you don't like about it, move this tooth here, move that tooth there, check the occlusion on that. And it's so much more back and forward, two-way, rather than take the impression, send it off to the lab, 2 weeks later, you get the wax up back and you either like it or you don't.
Yeah. And
it's a very, very staccato way of planning a case. Whereas if you're doing it digitally, it's, you know, the lab can send it to you, you can check it in your phone, you can check it in your iPad, tell them what you like and don't like, and then it's back to you within the same day or the next day modified. It's just so much easier.
Yeah, brilliant stuff. And from in terms of labs that you work with, Tiff, if we move on to yourself, do all of the labs you work with accept intraoral scans? And
yeah, absolutely. I mean, I think it's becoming almost like a standard now. I mean, in fact, there are some ortho systems that won't even accept impressions anymore. Actually, you'll see those start to emerge. And in IAS we work with lots of different aligner systems, and we're doing a lot of kind of testing and teaching for various systems as well. And it's interesting to see one or two that have sort of been launched recently. You can't even send an impression, which is quite interesting, isn't it? Yeah. They probably don't want the hassle within their departments and the whole processing of it. But actually, I think the really useful thing, yes, obviously the speed, the fact that you can analyze, you can look at your scan before it goes, you can analyze what you want, and you can put into your prescription from looking at your scan, rather than, obviously if there's an impression sitting there, you can't always remember, okay, you might have photographs, but you can't look at it in 3D. Then obviously, you submit your scan to the, whichever, aligner provider it is. And then, hopefully, particularly if you've got somebody where there's an actual physical person at the other end, which a lot certainly do, you can then modify things. So they'll send back a treatment setup or a 3D proposal. And the great thing is you can see that, you can see your scan that's been slightly modified, how that relates to the patient's face. And if, for example, they've perhaps flared the teeth a little bit too much, we can ask for them to modify it, it'll come back. And all of these things are so much faster and so much better than thinking, they've taken an impression, you've got to do another impression to set it. It just doesn't happen. So the back and forth to actually then sort of fine tune your end result is so much quicker. And it just means that, and then even through treatments, if you're looking to refine things, and you've always got that same original scan, your comparison position, where you've got to, what you're trying to achieve. I think it's just like I can't even think back to how it was before, if I'm honest. Yeah. So it makes all the difference now, particularly in ortho. I think it's just immensely important.
Yeah, very good. And Daz, and I kind of just add in a little bit as well. I remember there was one particular dentist, and I did a training with him. We scanned some patients as part of the training. He worked with a couple of labs, and one was very digitally enabled and one wasn't. Now, he wanted to send the scans to the lab that wasn't particularly digitally experienced. And my advice to him was, I said, look, let's cut out the unknowns here. Let's work, you're now fully digital. Let's work with a lab who's fully digital and experienced and so on. Let's take out those unknowns. And so we sent the work off, and that was great. And 2 weeks later, he called me at lunchtime, munching on a sandwich. And he said, Mark, he says, this is something I didn't factor in. He says, the girls are gone for lunch. I'm here at lunchtime, having my lunch at lunchtime. The morning went smooth. Those 3 patients that we scanned during training, they've come back, and we fitted our crowns this morning. And he said, I totally underestimated. His comment was he always thought he took good impressions, and that his work was always good, until he got to scanning, and the lab work came back, and everything just dropped in. So has it been a similar experience for yourself, Daz, in terms of when work comes back from the lab, that you can be confident that it's going to fit and minimal adjustments?
Yeah, very much so. I mean, it's we work with a lab in Chorley, and to be honest, Andy and I have gone on a very sort of similar sort of progress of learning. So I mean, when I said that, look, all my work's going to go digital, he decided to feel that, that was a similar sort of change he needed to make in his lab as well, to look at trying to be able to accommodate things like that. And what I found it's just that the work, when you get it back, just drops in, as you say, and, margins are perfect, crowns looking great. The implant side of stuff was really interesting, because now using some like the ELOS scanning bodies that we use, it's just so simple and so straightforward, just to be able to take a quick scan, get that sent off. And, it's just, I'm always amazed at sort of when all the work comes back. I'm still amazed Andy still sends me printed models that he's still checking and verifying things, because when I get the work back, it just drops in, to be honest. So I'm always, yeah, I mean, I love the fits I get back from it. I mean, certainly before when it was a little bit more manual, not to say that things didn't fit, but, you know, I don't know, it's just very much, I don't know how to describe it, but it literally just drops in, and it drops in very nicely as well.
Okay, brilliant stuff. And actually, interesting you mentioned ELOS as a product. You know, obviously TreeShape is a very open platform, and I suppose people think of it open as being you can export an STL file or you can import an STL file, and that's just the very tip of the iceberg. Being open is so much more than that. And what I mean by that is that you want to be able to pick up your scanner, you want to be able to do a scan, you want to be able to send it anywhere, and currently you do, whether it's an ortho lab or a restorative lab, or for implant work. And I'm not sure for yourselves if it's a service you offer your IAS students, that they could send you scans potentially for you to work through and mentor on from a case support point of view. But ELOS, you know, we were scanner people from the outside, from the outset. TreeShape was the only product we did, and we took pride in that, and it was a very important business thing for us. But what we were finding then was that people were using the scanner and maybe scanning with scan bodies, and sending the scan onto the lab, and then the lab would call and say, well, we can't do what we want to do, or we don't have a model analog for this, or what. You know, and that little scan body that you screw into the implant was actually locking down a full workflow. And so STL, you know, that's totally irrelevant. It's where you send the scan and what you can do with what the lab can do with the scan on the other end. And one of the reasons we took on the ELOS product range was because it was such an open product. You could take a scan with an ELOS scan body, and if you said to Andy at the lab and say, look, I want you to use ELOS components, I am building this restoration, you can. If you said to Andy, I want you to, you've got access to milling custom crowns yourself, go for it. Or you want to use some of the mainstream milling services and implant providers, you can do that as well. So that one scan body is massively open, and it opens up opportunities on the other end as well. So it's just an important thing to kind of be aware of, that small little plastic component you're screwing into a patient's mouth could lock everything down. So thanks for just mentioning that. I think it's an important message to get out there. What's your next step, Andy? What's your next step in terms of digital at Bachelor's Walk? Or is there a next step?
We are pretty much digital in everything. Mm-hmm. Digital radiograph, digital practice management, intraoral scanner, chairside milling. I'm not sure there's much more that we can do. I suppose COVID has pushed us to do some other things a little bit more digital as well. We're doing some Zoom consultations digitally. We're doing medical forms and things digitally online, where that used to be a paper thing. I'm not sure. I think we'll need to explore the online patient consultations and patients sending us some of their own records. You know, where there's platforms out there where patients can take pictures of their own teeth and send them through, and then we can have conversations that way. I think that's the next thing that we'll be looking at. But in terms of what we're doing in the practice, you know, physical, digital things, I'm not sure there's much more that we can do.
Okay. And for yourself, Tiff?
Well, I was going to say one thing, Andy, that I know you are doing that you maybe didn't mention there, was actually using your scanner to monitor dial cases as well. Because I know you started doing that before me, and I was like, oh yeah, that's a good idea. So yeah, but you know, dial principle, something that we all use, we all teach. We teach it in quite a lot of detail in IAS. But one really neat thing about the patient monitoring is that actually we can kind of capture dial cases. So before treatment, after treatment, and then actually to watch the movements that occur, and it's actually fascinating. We've got a few videos that I'm just literally about waiting to finish now, to show people how it works. Because the interesting thing is, it's quite a controversial subject. You know, there are still people out there that think it doesn't work and that the teeth aren't moving and there's no compensation at all. When you see these videos, I think you're going to realise that it's the case. It does work. We know it's worked for years. But yeah, I'm monitoring things like dial cases, but even I'm monitoring just even monitoring my own line bleach bond, edge bonding, just to see how rapidly things might, or how slowly or rapidly things might be wearing. I'm using it to monitor the amount of composite on the back of my retainers. So I put the composite on the teeth, and then, you know, the whole idea in 1 year, 2 years, I'm going to just see then how much more volume there is on the composite, because we can then start to get an idea of how fast it's wearing away, and then we can then start to think, okay, that's probably going to be 3, 4, 5 years down the line, we're going to need to do something with it. And then and I think it's always better if you're talking to patients about that, and you're saying, you know, it's wearing at this rate, might be 2 or 3 years. When it happens, it's less of a shock, isn't it? They're ready for it. So from my aspect, it's going to be using, you know, the software is there, and it's, you know, it's been there, but it's actually using it in slightly different ways to expand on and to diagnose and examine to an even higher level. I think that's what we're aiming to do.
Yeah.
But I've got to give the thumbs up to Andy, because it was Andy that thought about using it for DART first. I didn't even think about it.
I think, you know, it's also one of those sort of situations where, you know, you've got those excitements up that are there, and like, just, you know, it didn't even occur to me that actually, you know, maybe I should actually be trying to use them so I can show how teeth can move. So it was just, as I say, Andy came with some great videos that shared it amongst us, and I thought it was fantastic in terms of that. So I really think that, you know, we could be looking, trying to really implement a lot of that into some of the teaching and stuff like that we do as well, just to be able to give people a bit more clarity over, like, you know, this is where we started, this is where we're at, this is where things are moving to, and then just being able to transpose that against some of the digital plans that we make as well. I think it's just going to be, great. I think we just need time to sit down and just be able to collaborate it all. But I think once we do, I think it's going to be fantastic. So I definitely owe Andy a beer for that, you know, once we can actually meet up and have a beer.
Well, that's it. Yes. And I suppose in terms of technologies, I know, Daz, that you picked up a 3D printer there a few months ago, and we made a little bit of progress to get you set up.
I thought we were going to keep that on the down low, mate, to be fair. But
but in terms of in terms, obviously you've got a chairside milling solution that you had in place for years. You see any other technologies kind of coming on board, which or let's say the 3D printer, when you get obviously it takes time to investment of time to kind of get things up and running. Is that something you see yourself kind of embracing into practice, or is that something you feel that, okay, I could do it, or, you know, I've got a great lab behind me here?
No, I think there's an element of both for sure, Mark. I think that for me, I think that I definitely think that 3D printing is it's come along so much over the last few years. It's quite phenomenal, and I definitely want to look at trying to bring that into our normal sort of way of working. I mean, we make a lot of stuff in-house, and I definitely think 3D printing would be a massive boon for us in terms of sort of how we go about trying to get that integrated into the practice. Right now, it's not just me who does a lot of that sort of stuff. You know, I have a business partner, we have therapists as well. And for me, it's just trying to wrap my head around how we try and get all of this done without somebody coming to me and saying, Daz, can you show me how to do this again? Or Daz, can you print this? And Daz, can you do that? So, you know, for me, it's just about trying to integrate it. I definitely think that there's a massive place for 3D printing in terms of what we can do, even as simple as, you know, I know Tiff talks a lot about sort of, you know, getting STLs and just sort of being able to show, like, this is where we're going to start off as a patient, this is where we're going to finish. And, you know, if I could just get those STLs and I can print them myself and then be able to show the patient and say, look, this is actually where we want to try and take you to. And by having that technology in practice just makes it so much easier, because it actually drives down my costs from the labs to then, or waiting. And it's literally just a couple of emails, and then be able to give that to a staff member to be able to do that. And it's just trying to find the right team members, trying to find the right amount of time so I can sit down with people and say, look, this is the workflow that we want to try and put into practice. Yeah. I think would be quite ideal. Sure. But right now, yeah, my 3D printer needs a little bit of TLC.
Yeah.
If I could just go back, actually, interestingly enough, when you mentioned 3D printers, I have one, but I'm not using it very much. But one thing Daz and I were both doing a couple of weeks ago with Ian Buckle was looking at the potential of 3D print splints.
Yeah.
And Daz and I both had Ian printed 3D splints for us. The way he did it was unreal. We sent him scans. He sent them off to the lab tech in the morning. The lab tech designed the splints for us, and they were back within a couple of hours. And then Ian 3D printed splints all within a couple of hours. So, you know, that is something that once I can work out a workflow to do. I think that has huge benefits, because one of the reasons I use splints for folks is for pain relief and for diagnostics, and to have to add an extra couple of weeks into that to send it off to the laboratory and have it made. You know, my laboratory will do it kind of in a backwards fashion. I'll send them digital scans, and then they'll 3D print the models and then do it analog from there. So if I could do that in my own place, have the splints ready for the patient in a day or two, you know, that would be brilliant, absolutely brilliant. We just have to get Ian to teach me how that workflow works and go through the Splint Studio workflow.
Yeah. And I think that you know what we're still talking about the lab, and this is, you know, for us now, and we've been advocates of digital technology for since 2007, and you know, we've been interacting with dentists and orthodontists and labs and hospitals, and a huge customer base all over the world, and very often the lab technician will maybe be a bit concerned. It's like, well, all this digital thing, is it going to make me redundant? Where am I going to fit in and on all of this? And I think change is the word there. It's just going to change how you do things. Who's going to design the splint? The lab is going to design the splint. You know, who's going to design your digital wax ups? You know, Andy, you made a very valid point. The most expensive thing in the surgery is your time. And people come to us and say, Mark, can we get the lab software? I really want to do full mouth, design full mouth wax ups. And I don't actually recall any dentist who we've nearly let or allowed buy that software, because, you know, it's not right for, I don't want somebody to take on some lab software when realistically there's no ROI, there's no cost benefit, and I'd be quite confident that after a couple of cases they'll be thinking, what am I doing here? You know, I should be outsourcing this and working with the lab. So the lab is, traditionally, you take something physical, send it to the lab, they send you something physical back. Now we're at a point of, you take something digital, send it to the lab, they send you something physical back. And now we're seeing more and more where you're taking something digital, sending it to the lab, they send you something digital back. And like that, if you're milling something in-house, or indeed printing something in-house, whether that be a diagnostic wax up or a splint, but it's easy, and you still, like, a dentist said to me before, he says, Mark, I'm a sales guy for my lab. The lab do the work. The lab make these beautiful restorations that I place in the patient's mouth. So and you know, I can prescribe the work, I can deliver the work, I can sell the work, but the lab actually does the work. So it's really important we continue to embrace and respect the labs. And you've all got long-standing lab relationships. I'm sure that, you know, is really important to you. And without that kind of relationship and support, you're not going to be able to do what you do for your patients. So that's, in my mind, a really important thing. So yes, you might embrace 3D printing in your practice, and there might be some things you can do in practice, but more often than not, you're going to involve the lab. So it's a really important kind of relationship and a reassurance, I suppose, to labs as well. Like, it's you know, things are changing, but for the better for everybody, and the workload is certainly still going to be there. And for yourself, Tiff, have you looked at embracing 3D printing or milling or anything like that in-house?
In my practice, personally, no, because I just do so much ortho, but actually one of my associates, he's really into the kind of milling and kind of printing idea, and I've got a feeling he's going to be pushing us to. I actually need to find out a little bit more myself about how it actually all works and the uses. So it's been interesting listening to, you know, Andy and Daz about their experience with Ian, and actually within IAS we're doing a lot more work with Ian moving forward, so that's for us quite an exciting thing. But yeah, I mean, it's well, I'm certainly open to it, and I'm gonna be listening to what my associates ask me very soon. Yeah. But we certainly do, as I say, we certainly do want, you know, within IAS, certainly we want more people to have scanners. And I'll tell you what, here's another interesting thing for us, because, you know, we're mentoring so many people's cases, and actually what's now, we've got the ability for people to put their scans on the mentoring site. Now, I'm not talking about just using a scan instead of photographs of diagnostics, but what would be great is looking at a case halfway through treatment, if there's an issue or if they're struggling or something, to actually be able to see a 3D scan of that their current position, because then we can start to assess the space creation, the quality of the the attachments, whatever, and that I think is going to move things on for us quite a bit for as mentors. So we're quite excited about that as well.
Okay. Excellent stuff, guys. I'm very conscious of time. We're an hour in at this point, and plenty more to talk about. But very appreciative and conscious of your time this morning. And certainly, maybe it's something else we can do again in the future. So maybe if we can just wrap up with one, what's your favorite feature of TRIOS and why, and one point of advice that you'd have for anybody who's looking at investing in an intraoral scanner. So Daz, maybe we'll start off with yourself.
I suppose I've got to be honest, the bit that I love most about my scanner is the fact that it's wireless. The fact that, I can just literally just pick it up and, I don't have that worry about sort of, is it going to take me longer to take a scan? Is it going to, am I going to get less quality of a scan? For me, I've seen it wired versus wireless. And for me, the fact that it's wireless is an absolute sort of godsend for the way that I work in practice as well. And I suppose the second part to it as well, Mark, and I think that, I've invested in the clinic. Over the last 12 years, we've invested quite heavily in intraoral scanners. And I think the most overriding thing that I would say to anyone who's interested in picking up or trying to invest in a scanner is that you've got to look at the support that you get after it. And I think that really determines how much you use your scanner and how well you use it. I've certainly heard people who have bought scanners in the past, and it's not as simple as just taking it out of the box and just using it if you've never used one before. You kind of need to be coached into it a little bit. But once you're sort of going, then everything there should be fine. But, inevitably, I've heard of people who've had separate issues with it. And if the support isn't there, then I think you're going to find it, what you're looking to try and get out of it is not going to be as great. So certainly from my side, what I'd recommend is, just invest in the time to making sure you've got the right support.
Okay, great. Okay, thanks, Daz. And Tiff?
I think still, it's amazing because, you think you get used to looking at scans every day, but I think the wow factor, the initial impact wow factor when you take a scan of a patient for the first time still kind of strikes me when they've never seen that before. And then, you're literally almost fighting them off for the questions that they're asking about what's going on. And what's this, what's that? And I think I love that. It gives me a real buzz. And then actually, even the follow-ups, whatever, I think the how clear the images are as well. I think, I've looked at quite a few different scanners, and sometimes some of the images look a bit almost cartoonly and synthesized, whereas, the TRIOS, it just looks real. It just looks like what you're actually seeing. I think that's really, really important for diagnostics as well. So yeah, I think overall as a package, for me, it's just does everything I want it to do, I think, as a whole. Advice, I would say, like as we mentioned earlier, don't just think about impressions. It's not about just impressions and saving money in impressions. It's about taking your dentistry to a much, much higher potential level if you want to do that. And if you want the conversations with patients that perhaps you've never had before. So I think it's look at it as a much more kind of holistic thing, and then sort of take the benefits of it and speak to people that have got them. But once you speak to people who actually got them, I think you'll be hard pushed to find a reason not to have one, actually. So I think use them in every possible way you can to advance your career forward and your diagnostics forward.
Okay. Great stuff. Thank you very much. And Andy, for yourself?
In terms of my favorite feature, I suppose, is it a feature? It's just the usability of it. It's so fast and it's so easy to use. You can genuinely use it all the time. You don't have to think about it. You can just lift it and use it. In terms of advice, years ago, lots of people were buying scanners and they were becoming fancy coat racks because they were hard to use, they took time, and you had to be invested in wanting to use it and taking the education that you needed to use it. Now these things they're not quite point and shoot, but they're very nearly there, and you can buy them and be sure they're going to be used. So don't be afraid about taking the investment. You know, they are genuinely something that everybody in the practice can use, and it's not just going to be for the principal. The associates can use it. Everybody can use it. So don't be afraid about actually taking the leap, because the learning curve on these things is not anywhere near what it used to be. It is very straightforward.
Okay, great stuff. And would you concur with Daz's point there in terms of support, that it's important to have somebody at the end of the phone or at the end of an email, that when you need it, that there's somebody there for you? I've had very little cause to use support. Thankfully, it has been working very well, but we've had a couple of issues where I had to contact your guys, and it was done via the website, and same day they're dialing in, sometimes within an hour. They're dialing in with TeamViewer to sort out the issues, and they tend to be sort of Windows update issues, those sorts of things, and they were sorted very, very quickly. I've had experience of other support issues in the past that have not been, not with 3Shape or ESM, but digital issues in the past where it has taken a long time to get past some things, and I have not had that issue with yourselves. It's been very, very reliable, and any issues we've had have been sorted out super quick. Great. Good to hear that. And, you know, we invest in support. TRIOS, any technology can be amazing, but its weakness is the support. You know what you need, and in order for you to embrace it, and in order for you to be confident, you want to be confident to every time you pick up the scanner, which is multiple times per day, that it's going to work and it's going to do what you want it to do. And if not, at least you've got somebody in your back pocket there that you're going to call on, and you know that they're going to respond. So that's really, really important. And you know, it's important to us, and so and I appreciate your kind comments about that as well there. So brilliant. So look, guys, again, you know, I really appreciate your time this morning. The most expensive thing in the surgery is the dentist's time, and so, you know, I definitely appreciate it massively, and for all your kind comments, and plus just genuine, honest feedback there. Oh, little focus has gone in there. Focus has gone there. It's just good, honest feedback. I'm really happy to hear how you're using it. I enjoy every conversation with every dentist, both from that very initial conversation all the way through their journey. And people are using the scanner in amazingly different ways. And it's a lot more than just a digital impression. It's a lot more than an alternative to conventional impression. So thanks again for using it to its fullest, and for sharing your story as well.
Great.
Okay.
Thanks, Mark. Thanks for having us. Thanks for all your help as well. Thank you very much. No
problem. You're very welcome. It's always a pleasure. Listen, so have a great day, guys, and enjoy all the sport that's on today, this Saturday, and we'll talk to you soon.
Thank you.
All right. Take care. Bye-bye.
Bye.
Bye. Bye.